Alison earned her MFA from Claremont Graduate University with a concentration in painting, an MA in education from Pepperdine University Graduate School of Education and Psychology, and a BA in arts from Pepperdine University. Her paintings have been exhibited in Los Angeles, New York, San Francisco, San Diego, Dallas, and Washington D.C., as well as internationally in Paris, France, Venice, Italy, and Tokyo, Japan. Alison was diagnosed with stage 2B breast cancer in 2014, which metastasized to stage 4 in 2016. She has received treatment including chemotherapy, surgery, radiation, and hormone therapy consistently for the past 9 years. She is a true warrior. With 3 different metastatic relapses, Alison has had many opportunities to pivot, to adjust, muster strength, change course, and continue to live her life. She believes that even here, in the middle of a metastatic cancer diagnosis, there is so much laughter, love, life, and hope. Please welcome Alison Rash talking to us about living with uncertainty.
Thank you so much. Okay, can you hear me okay? My daughter's 12, and I talk a lot with my hands, and she's like, Mom, you don't need to talk with your hands. You have a mouth for that. But I'm going to use the stand so I can use my hands to talk today, too. Thank you, Tracy. I always leave resilience with more than I ever come with, than I ever bring. So, I see girls your age die in 2 to 3 years. I think I can give you longer, and there's potential, small potential, but potential that you could be cured. Almost 9 years ago, my doctor spoke those words to me in his thick Lebanese accent. I'd been diagnosed with breast cancer just the year before, and it metastasized to lymph nodes in my neck. So it was still breast cancer, now stage 4. Today, 9 years after hearing those words, I stand before you in the longer. Over the last 10 years of living with cancer, I've undergone continuous treatment with 1 6-month respite in there before my first of 3 metastatic relapses. This has included chemotherapy, a bilateral mastectomy, 33 radiation treatments to my right breast and axilla, more chemo, 33 radiation treatments to my neck, more chemo, 5 doses of radiation to my hip, and even more chemo. I've had 4 ports, 75 hyperbaric oxygen therapy treatments, and I had an open port wound for 2 years. I've experienced many physical side effects from these life-saving, life-extending treatments. Mouth sores, nausea, vomiting. My kids have shaved my head 4 times. Hospitalization for a low white count, neutropenic fever, low platelets, bone pain, constipation, diarrhea, fatigue, extreme sleepiness, sleeplessness, muscle cramps, a blood clot on my fourth catheter near my heart. The list goes on. Lymphedema, which Tracy treats. By the way, if you go to PT at the cancer centers, John is my younger brother. You can call him Johnny. Yes. But I don't share this list of treatments and side effects for sympathy or for comparison. I share this list because the physical side effects have required a lot of me, but to some degree I was prepared for these things. These are things I was taught about in my chemo teaching from my nurses. I'd seen other cancer patients go through them in movies, in real life. I'd heard about them in all of the medication commercials online. Many of these physical side effects are worn on the outside of our bodies, so they come with an inherent visibility to them. But something that I wasn't prepared to deal with when I heard the words, "You have cancer," something that is not as visible but just as present, I was not prepared for the sudden, persistent, and relentless awareness that nothing in life is certain. Before cancer, it was like I was standing on the beach with my toes digging in the sand, and I would experience waves of uncertainty throughout my life, and they might rock me for a minute, but my feet were still firmly planted on the shore. The words "you have cancer" carried with them a tidal wave that swept me deep out to sea, and suddenly I was aware that nothing was certain. Of course, this had always been true, but I had had the luxury of keeping that at arm's length. The knowledge of that, I kept it siloed. Cancer, however, brought with it this barrage of uncertainty, and the sheer volume and intensity was so overwhelming, it suddenly became impossible for me to look away from it. My awareness of uncertainty, at that knowledge, threatened to drown me. I don't think anyone with a cancer diagnosis or a pulmonary embolism, a diagnosis whether it is stage 0 or stage 4, whether it required one surgery or procedure, or you have ongoing treatment, I don't think anyone is spared from this tidal wave. There's the testing that leads to the diagnosis, the waiting, the time it takes to determine a treatment plan, the scans, the waiting, the second guessing, and all of the uncertainty. Learning to exist while swimming in uncertainty has been a practice that has required more of me than I ever expected. I wish there was a pill or an easy fix for it, like there are for some of the physical side effects we experience, and I do take an anti-anxiety medication, but swimming in the discomfort of not knowing is a continuous practice. The work that it requires to widen my window of tolerance for uncertainty is constant and unabating, yet has been so important and powerful. I want to share with you 3 things that I come back to over and over again when I'm confronted with inevitable uncertainty. So the first one, of course. I was sitting across from my counselor in California where we lived shortly after my first diagnosis. And I looked at him and I said, I feel like if my faith was stronger, I wouldn't be so afraid to die. And he said, well, that's fair. He said, but you've also never died before. Of course you are scared. And that was the first time I'd ever heard those words said in that way. And then a year later, after we relocated back to Nebraska, I was sitting in my new counselor's office, and I said to him, Pete, I miss California. And he said, of course you do. And his words, of course, allowed me to feel like I could miss it without feeling like I was missing out. It's a place I love, filled with people I love. So as you sit in this room today, feeling whatever you might be feeling, of course you do. Like me, you probably had never imagined that you would be a person with cancer, or that you would have to sit next to your loved one and watch them struggle in this way. Maybe you've never been aware, so aware, of all the uncertainty that comes with living. So when another wave of uncertainty threatens to pull me under, I practice treating myself with gentleness and think, of course this feels uncomfortable. Of course I'm feeling anxious, of course I'm angry, scared, jealous, spinning, or the opposite. Of course I'm experiencing more joy. Of course I'm elated to get to witness this moment. And of course I'm over the moon that my scans right now are clear. Of course I can feel the paradox of both joy and sorrow right now. So whatever the experience brings, of course it does. The second thing that I keep coming back to over and over is that is not happening right now. So in the early days of my diagnosis, while on a walk around our block with my husband Bryan, I looked at him and I said, if something happens to me, I want you to get remarried. I want Flynn and Zuzu to have a mom. And he stopped and he looked at me and said, you're already trying to control me from beyond the grave. He said, if something happened to me, I could trust that you would do whatever was best for the kids. So a couple years later, after one of my metastatic relapses, I was sitting on his lap in his office and I was crying and I said, I want you to get remarried, but I really just want it to be me. And he gently patted my knee and he smiled and said, that is not happening right now. And those words, that is not happening right now bring me back to the present moment over and over again. When another wave of uncertainty comes, I find myself wanting like a life raft to grab onto. I look into the future and project all of these scenarios that might happen. Swimming in uncertainty is so uncomfortable that my mind just wants something to hold on to, even if that thing is sad or hard to think about. But Bryan reminds me so often that that is not happening right now. He actually brings me back to the only moment that is certain, which is now. Right now I'm standing in this church, in this room, in front of you beautiful people sharing some of my story. Right now I'm here, and I never want to miss this by projecting myself into the future and imagining and playing out all the things that could happen. Because, as Bryan says, that's not happening right now. And then the third thing that I come back to over and over again is nobody knows. So when I received my diagnosis, I wanted to know that I was going to be okay. I wanted the doctors to tell me that they could fix it. I wanted to know that the treatment would work. I wanted to know that the cancer would be gone and never come back. I wanted to know that I could stop wondering and worrying. And I wanted to find somebody who just knew. I wanted certainty. But nobody knows. Nobody knows the future, and at first, that thought felt terrifying to me. But as time passed, rather than being a phrase that instills fear, it's become a phrase that feels full of possibility. It can be easy to identify with the possibility of a negative outcome, but an outcome can also be full of potential and full of hope. Nobody knew that even though median survival for what I have is 2 to 3 years, I'd be standing in front of you today 9 years later in the longer. Nobody knows how long I will live. Nobody knows what new treatments are just around the corner. Nobody knows what happens next. When the waves of uncertainty come, because they continue to come, the phrase nobody knows buoys me and allows me to ride along the waves without being swallowed up by them. Because nobody knows, and how exciting is that? So these three phrases, of course, that is not happening right now, and nobody knows are part of my continuous practice. Whatever uncertainty you're facing today, whether it's with a cancer diagnosis, as a caregiver, with your job, your family, with our country, with life, I pray that these phrases may be useful to you as well. They help me come up for air without drowning. They help me confront the inevitable, relentless waves. They help me widen my window of tolerance for not knowing. And they help me live alongside uncertainty. So my toes do not dig in the warm sand on the shore. I do miss that. I've been flung far out into the deep ocean. But now I can swim, and I no longer am surprised by uncertainty, I expect it.
I get to hang out with her every couple of weeks, and we have these incredible, insightful conversations, and every time I learn something new from her, including today. Thank you, Alison, so much for your insightfulness and the beautiful way that you express it and share it with us.